Causes of high blood pressure and how to lower it. High blood pressure, or hypertension, is a critical health issue that affects millions of people globally. It occurs when the heart must pump harder to circulate blood through stiffened or narrowed arteries, leading to increased pressure on the arterial walls. Over time, this strain can result in severe health complications such as heart attacks, strokes, kidney damage, and vision loss. Although medications are often prescribed to manage high blood pressure, they primarily address symptoms rather than the root causes. This guide explores the real reasons behind high blood pressure and shares natural, effective strategies for managing and reducing it. And stick around since number 2 might just surprise you. A quick reminder. This video is intended for informational purposes only and should not be taken as medical advice. If you have any health concerns, it's best to consult with a doctor. Let's start with dehydration. It's a significant yet often overlooked cause of high blood pressure. When the body lacks adequate water, it triggers the release of a hormone called angiotensin. This hormone causes blood vessels to constrict, thereby increasing blood pressure. Dehydration also leads to thicker blood, making it more challenging for the heart to pump efficiently. This additional strain on the heart can exacerbate hypertension over time. Beyond direct effects on blood pressure, chronic dehydration can impair kidney function, further complicating the body's ability to regulate fluids and blood pressure. Maintaining proper hydration is one of the simplest and most effective ways to combat high blood pressure. Drinking at least 2 liters of mineral water daily is recommended to keep the body adequately hydrated. Additionally, limiting diuretics like caffeine and alcohol can help prevent excessive water loss. Individuals who sweat heavily due to physical activity or hot climates should monitor their hydration levels closely to ensure they replenish lost fluids. Prioritizing hydration supports not only heart health, but also overall bodily function. Addressing dehydration can lead to significant improvements in blood pressure and overall cardiovascular well-being. Next, let's talk about potassium deficiency. Potassium is an essential mineral that plays a critical role in maintaining blood pressure by balancing sodium levels in the body. Sodium retention can cause the body to hold on to excess water, increasing blood volume and, consequently, arterial pressure. When potassium levels are insufficient, sodium accumulates unchecked, leading to fluid retention and additional strain on the heart and blood vessels. Potassium also helps relax the walls of blood vessels, further reducing blood pressure. Unfortunately, modern diets often lack adequate potassium due to a reliance on processed foods, which are high in sodium but low in essential nutrients. To counteract potassium deficiency, incorporating potassium-rich foods into your diet is crucial. Leafy greens, avocados, salmon, and cucumbers are excellent sources of this vital mineral. While bananas are often associated with potassium, they are also high in sugar, making them a less ideal choice for blood pressure management. Avoiding high sodium and processed foods is equally important to restore the balance between sodium and potassium. Increasing potassium intake not only helps lower blood pressure but also supports kidney function, which plays a vital role in fluid regulation. At number 4, we have high cortisol levels. Chronic stress and poor sleep are significant contributors to elevated cortisol levels, a hormone commonly associated with the body's fight or flight response. When cortisol levels remain high for extended periods, blood vessels tighten, causing blood pressure to rise. Additionally, high cortisol levels can overstimulate the nervous system, preventing the body from relaxing and recovering. This combination creates a vicious cycle where stress exacerbates hypertension, and hypertension further stresses the body, leading to long-term health complications. Reducing cortisol levels is essential for managing high blood pressure effectively. Natural remedies such as magnesium glycinate, vitamin B1, and lemon balm tea have been shown to promote relaxation and reduce stress-induced hypertension. Engaging in daily activities that foster calmness, such as walking, yoga, or mindfulness meditation, can significantly lower cortisol levels. Prioritizing quality sleep is equally critical, as poor sleep can trigger further spikes in cortisol. Establishing a consistent bedtime routine, avoiding screen time before bed, and creating a comfortable sleeping environment are practical steps to improve sleep quality. By managing cortisol levels, you can break the cycle of stress-induced hypertension and support overall heart health. Coming in at number 3, high-carb diet. A diet high in processed carbohydrates, including refined sugars, starches, and grains, is a leading cause of inflammation and arterial damage. These foods rapidly spike blood sugar levels, triggering a cascade of harmful effects that can damage the walls of blood vessels. Over time, this damage leads to plaque buildup, narrowing the arteries and increasing blood pressure. Additionally, high-carb diets contribute to weight gain, which further exacerbates hypertension by placing extra strain on the heart and blood vessels. Transitioning to a low-carb, whole food diet can significantly reduce the risk of hypertension. Focus on nutrient-dense foods like lean meats, fish, eggs, vegetables, nuts, and seeds. These options are not only low in carbohydrates, but also rich in anti-inflammatory properties that support cardiovascular health. Avoid processed and packaged foods, sugary beverages, and refined grains that can spike insulin levels and promote inflammation. A balanced diet rich in healthy fats, such as those found in avocados and olive oil, can help stabilize blood sugar levels and reduce arterial damage. At number 2, we have a truly surprising entry: calcium overload. Excessive calcium intake, particularly from supplements like calcium carbonate, can lead to the buildup of calcium in arteries. This accumulation causes arterial stiffness, reducing their ability to expand and accommodate blood flow. Stiff arteries not only elevate blood pressure, but also increase the risk of cardiovascular events. While calcium is essential for bone health, excessive amounts from unnatural sources can do more harm than good, particularly for those already at risk of hypertension. To avoid calcium overload, prioritize obtaining calcium from natural sources such as leafy greens, almonds, and high-quality cheeses. Pairing calcium intake with magnesium and vitamin K2 is also essential, as these nutrients help direct calcium to the bones rather than allowing it to accumulate in the arteries. Avoiding synthetic calcium supplements and opting for a balanced, nutrient-rich diet can help prevent arterial stiffness and lower blood pressure. At number 1, we have excess belly fat. Visceral fat, or fat stored around the organs, is closely linked to high blood pressure. This type of fat releases inflammatory chemicals called cytokines, which damage arterial walls and cause them to stiffen over time. Stiff arteries create greater resistance for blood flow, forcing the heart to work harder and raising blood pressure. Visceral fat also disrupts hormonal balance, further exacerbating cardiovascular risks. Reducing visceral fat is essential for managing high blood pressure effectively. Adopting intermittent fasting or a low-carb diet is a proven strategy for targeting stubborn belly fat. These approaches help regulate insulin levels and encourage the body to use stored fat for energy. Combining dietary changes with regular physical activity, such as walking, strength training, or swimming, can accelerate fat loss and improve heart health. Reducing excess belly fat not only lowers blood pressure, but also decreases the risk of other metabolic disorders, making it a critical focus for overall well-being. Other factors like low vitamin D levels, smoking, lack of exercise, and sleep apnea can also trigger or worsen high blood pressure. Quick fixes include spending more time in the sun to boost vitamin D, quitting smoking to reduce arterial damage, engaging in regular physical activity to improve circulation, and addressing sleep apnea to ensure the body receives adequate oxygen during rest. High blood pressure is often a result of lifestyle choices, but the good news is that small intentional changes can have a profound impact. And remember, always consult a doctor if you have any doubts or medical issues. If you enjoyed this video, don't forget to like, subscribe, and tap the bell icon to stay updated with more health and wellness content.